Secretary.
Thank you, sir.
Your father served here with distinction. It's a particular pleasure to see you here this morning. Madam Secretary, do you believe that the emphasis on annual recommendations will limit the board's focuses to short-term fixes rather than lowering our nation's health care spending in the long term? Yes or no?
No.
Madam Secretary, under the Republican plan, nothing will prevent private insurance companies from raising care. Is that right?
I'm sorry, nothing?
Under the Republican plan, nothing would prevent private insurance companies from rationing care. Yes or no?
That is correct. There's no prohibition.
All right. Now, IPAB is legally prohibited in the legislation from making recommendations that would ration health care. Is that right?
Yes, sir. There is a prohibition for rationing care, shifting costs to beneficiaries, eliminating benefits.
Now, Madam Secretary, who's in charge? Under the Republican plan, the insurance companies. The Republican plan would, is that right?
If I understand it correctly, yes, the voucher would be paid to an insurance company.
It also, the Republican plan ends Medicare as we know it and repeals the Affordable Care Act, giving free rein to the insurance companies to decide what care you can get and when, with no clear limits to protect consumers or prevent insurance companies from taking in exorbitant profits. Is that right?
Well, the various features, including the medical loss ratio and consumer protections and rate review, would all be eliminated with the Affordable Care Act, and companies would then be in charge of seniors'
Now, under
packages.
the Affordable Care Act, the individual and that individual's doctor would be in control of matters, and the President's plan maintains Medicare as we know it. Is that right?
Well, it is a plan that maintains the Medicare benefit package, understanding we need to look seriously at outgoing costs.
And the plan remains a defined benefit plan. Is that right?
That's correct.
Which under the Republican plan it is not. It's a defined payment plan. Is that right?
Yes, sir.
All right. Now, the Republican plan would eliminate Medicare's guaranteed benefits and limits on cost sharings and premiums. Is that right? Yes or no?
Yes.
Instead, insurance companies could determine which benefits seniors on Medicare would receive and how much they would pay. Is that right?
I assume so, sir. I don't think there's any written language about what the benefits would look like.
IPAB is under the President's plan. IPAB is legally prohibited from cutting premiums or increasing premiums and co-payments. Is that right?
Yes, there cannot be cost shifting onto beneficiaries.
Now, under the Republican plan, health care costs would rise, which turns Medicare over to private insurers that have higher administrative costs and profits. Is that right?
Yes, sir. Currently, the Medicare program runs at under 2% administrative costs, and I think the most efficient private insurers are at about 12 to 15%.
Now, IPABs will make decisions based on what's best for seniors and Medicare, and not who spends the most money in Washington. Is that right?
By law, they are directed to protect the beneficiaries as they make recommendations.
All right. Now, Madam Secretary, how will you and the board ensure that consumers' and patients' views will be taken into consideration as the board drafts its recommendations?
Well, Congressman, I think that there's no question that the President will look for members of this board who are eager to not only participate in the long-term solvency of Medicare, but also pay close attention to the protection of the beneficiary, which is part of the fundamental
We also will
direction.
have public hearings on these matters.
Public hearings,
Right.
I think the appointment of
Madam
people who don't have a
Secretary,
conflict.
Is it your belief that the board would benefit from soliciting public comment prior to issuing its recommendations in
Absolutely.
a manner similar to that specified in the Administrative Procedures Act?
Yes, sir.
I guess we can say that's a commitment on the part of the department. Is that right?
Yes. Very much so.
Madam Secretary, it's always a privilege to see you. Thank you, Mr. Chairman, for your courtesy.
Chair thanks the gentleman and recognizes the gentleman